Good morning from Peaks of Health. So excited to be on location today with our next guest, who we love, Dr. Tracy Leonhardt, and so excited to actually see you, doctor, in your element. We're joining you this morning from their IV room, this very large IV room, which is a pretty popular thing that you're doing here.
Yeah, IV therapy is very popular these days. You know, it helps our patients tremendously, whether we're treating infections like viruses or Lyme disease, or whether somebody's just tired because they're overworking, they can get a vitamin IV. So we do everything. We just don't do vitamins. We have custom IVs. We do ultraviolet light therapy, ozone therapy, hydrogen peroxide therapy, IV antibiotics if they need it.
Okay.
And we do urgent care here. So we have all the medications if somebody's, our private patients can come in if they're sick. So we can actually treat them with IV fluids, medications, and things like that.
Rewind a little bit, and I want to hear more about kind of how this practice got started. And IV therapy has been something that you've done from the beginning, but talk about this location. There's been a lot of growth, which I think speaks volumes to what you're doing here, the success that your patients are having. Kind of explain a little bit and tell your story of how you have been able to grow this team tremendously.
Yes, it has grown a lot in the last 6 years. I started actually in emergency medicine. I did emergency and trauma for 18 years, and I was the medical director of Northside Hospital emergency room, and then I became ill. So in my plight to kind of fix my own illnesses, I went into weight loss initially, because I see people who don't know me, I used to be over 260 pounds and lost a tremendous amount of weight. But then I realized that wasn't the only thing. There was so much: thyroid, gut health, hormones, to kind of get my patients better. So I took off and started Peaks of Health to get people to the peak of their health. That was how it came about. And we started in a small location that was about 3,000 square feet. Outgrew it in 2 years, and then we bought this building, and we just expanded it again after another couple of years. So it's been a tremendous ride from that small office to now this is almost 14,000 square feet.
And you literally, when people come here, your patients come here, you are talking with them, hearing their story, and again, trying to get to what is really happening.
Well, I think right now there's a frustration because they don't get to actually talk to their doctors. The doctor doesn't have any time to listen to them. And so my new patient visit is close to an hour. So I get to have conversations with my patient. I get to know them. I get to actually listen to them. I get to hear what they have to say in a lot of cases. So that's where you can actually pick up the diagnoses. Most of the time the patient will tell you what's going on if you listen hard enough. So we get to catch things that a lot of people have missed, and I get to do testing that a lot of people don't get to do. So we have some specialty testing. And the IVs work really well because we have people who don't absorb very well. They've had gastric bypass and they can't get absorption. And when you can't absorb, if you take a vitamin, the best you can get is 30% absorption of what you just took.
Wow.
10% on a bad gut. When you do IVs, it's 100% going into the system. And when, like for vitamin C, you can take maybe 3,000 milligrams of vitamin C a day. I can put 50,000 in an IV. So we can tremendously improve that system and get things working again through the IV therapy.
And I have to ask, it's safe?
Yes, it's very safe if done correctly. I mean, my ER background makes it very easy for me to be very comfortable, but we also are very picky. We customize our IVs, but again, if you're using the right ingredients, you're actually watching, the mixtures. So we have...
and I'd imagine every person is going to be different. Their mixture is going to be different.
We do custom IVs. So I know there's a lot of places that do the, the standard IV, the Myers cocktail and those things, and that's all they do. But we actually customize a lot of our IVs for our patients, specifically on what they need, because we can actually test their nutrients, find out what they're deficient in, and start those replacements.
If someone's watching this morning, and again, I just love how passionate you are about really helping people find out what's going on, getting them on that path to wellness, what would you have them do? What's the first step to really kind of start their journey of their best health?
I think the first step is either to go on our website and take a look and contact us, or call us. The office staff is really great. They, we do courtesy 15-minute consults. So again, the patient can kind of give us their story. We can tell them what we can do for them and what we can't do for them, and then they can make the decision if this is the right place for them.
Well, again, Doctor, I love seeing you in your element, meeting your staff here. Certainly it feels like family here. And if you want more information, it's very easy to do. Check them out online or give them a call today and go ahead and set up that appointment. Thank you, Doctor. We look forward to seeing you again soon.
Thank you.